Hello everyone. Today I'm going to be addressing the Week 1 topic, which is the role of the manager in healthcare services. Your book and the PowerPoint explain the technical terms related to management and review the overarching themes related to managing healthcare services. All of these terms and theories are great to know and will definitely serve to help you in our discussion this week and probably in future courses as well. However, today I am going to discuss my experiences as a manager and what you might encounter as you enter the healthcare administration field. One of the things your textbook and the PowerPoints emphasize is that a manager in a healthcare setting is concerned with accountability. Managers need to demonstrate the efficacy of their program and the merit of those they supervise. This is definitely true, but it is a very broad idea and might look very different depending on where you work and what patient or client population you serve. In order for this theory of accountability to really be implemented, you have to identify a goal, either for your program, facility, or even just your project. A goal allows you a real way to measure your success and a real bar by which you can hold yourself accountable. It sounds nice to say our goal is to provide the best patient experience possible. But what does that really mean? That is far too broad a statement to give you any real direction in terms of management. The more specific your goal, the better you will be as a manager. A quality goal will be specific and measurable. It is our goal to provide our patients, homeless individuals in our community, with focused, high quality, and attentive primary care services efficiently and respectfully, and consciously refer each patient to additional resources which aim to alleviate homelessness at each visit. This goal is very specific and will give you a very good jumping off point from which you can extrapolate what your needs are and how you can maintain accountability and focus within your program or facility. Now you know exactly where your priorities lie and what your staff should focus on, and it will also make it much easier to manage staff members. This goal identifies the patient population, provides a primary focus for how to serve this population, and provides an achievable measure of success. Obviously, you will need to get into more specifics and define your terms, like what qualifies as high quality and attentive care. But this is a good example of a starting point for a goal for an organization. Once you have really identified your goals and values, you'll be much more effective as a manager. It is easy in daily life to really get lost in the minutia of running an office. One issue I have run into is division of labor over small, non-job specific tasks. I have seen this problem repeatedly impede the success of a program. When administrators, supervisors, or staff members quarrel over who needs to do what, programs become less effective. For example, I worked at one facility that struggled with identifying who needed to fax prescription requests. Nurses felt the CNAs should be responsible for this, and CNAs saw this as a receptionist duty, and the receptionist would ask the cashier to help complete the task, which made the cashier frustrated because he didn't get paid as much as the receptionist, but he felt like he was doing his work for her. It was just a mess. Now, something as small as faxing a prescription request should not overshadow the overall goal of a whole team of professionals, but it can if an administrator does not remain focused on the overall goal of the facility and on the task of demonstrating the efficacy of the program by meeting that goal. The solution was not complicated at all. Staff simply needed to be brought together and reminded by their manager that they all elected to work in a team environment with the team goal of meeting patient needs effectively and efficiently. When the team was able to refocus on this goal, they were able to work out a division of labor among themselves that was equitable and considerate of each other's needs and time constraints. The manager was effective in this instance because he remained focused on the overall goal of the facility and, rather than simply trying to gloss over the program by assigning the task arbitrarily, he reminded the staff that part of the facility's goal was to work as a team. The staff was able to resolve the problem themselves and, in tandem, demonstrated their own willingness to be held accountable to the goals of the facility. Now, it might seem like I'm over-focusing on this one point, but really, the most management issues can be resolved if the overall goal of the facility or program is clearly identified, and it's the driving force behind all of your decisions. Yes, there are other priorities and responsibilities you will face. Of course, you want to set effective agendas, you want to encourage employees to have healthy work-life balance, you want to resolve disputes, and the list can go on and on and on. But if you have a very clearly defined goal for your facility, you'll have a much easier time making all of those small decisions because you can always ask yourself, does this decision fall in line with our goal? I know this was a very brief presentation, but I hope you all have a little bit better understanding of the importance of identifying the goal for your facility or program and how clearly defined goals help make management an easier task. Throughout this course, I plan to continue to provide real-life micro examples of how healthcare management works in practice. Please let me know if you have any questions about this presentation or any of the work so far. Have a great week, y'all.